Hello everyone, Dr. Shelley here from Synergy Chiropractic in the Markham location. Today we are going to talk about feet. Feet can be a limiting factor in even in my direction to have our patients get more active, because as you know, I'm always talking about motion is lotion. But if you have really sore feet, the motion part is not so easy. So what I'm going to do today is talk a little bit about what you can do at home to improve the function of your feet. And even if you are a sufferer of plantar fasciitis or heel spurs, these tips are going to help you to help yourself. So a little bit of self-care for plantar fasciitis. So one of the first things I want you to do is, and this is particularly helpful in the morning, because I know a lot of people with plantar fasciitis, when they step out of bed, it's kind of like you're stepping on broken glass. So this may help you in that aspect. So it's very simple. When you're gonna bring your foot up, you grab your toes and you take your foot back as far as you can go, but then at the end you even take your toes back a little bit further. To help out, you can cup your heel and kind of push it like you're gonna push it out the window. So you push the heel this way as you're pulling the toes up that way. Now, of course, I'm not experiencing plantar fasciitis, so that doesn't create a lot of pain for me, but it may for you. So you always want to go to the point of stretch, but you don't want to go into a high level of pain. Now, you remember that you always hold your stretches for 20 seconds. So of course, you're going to do that on both sides. So that's one way to start getting the fascia to release underneath the foot. The second way you can do that is by, I have a lacrosse ball here. You can use a tennis ball or the dog's ball or whatever you can find. But you're going to just use it to massage out the bottom of the foot. Hopefully that doesn't roll away. So you just put your foot on top of the ball, and as you can imagine, you're just going to roll your foot over the ball. So you want to get it all the way back to the heel, and you want to draw it all the way up as high as you can, even into where the foot and the toes start, because that's a nice little spot that you can rub out that way. Now, if you're sitting and you have it on the floor, you can put a little bit more of your body weight into it than I can in this position. Good. Now, if you're having an acute situation with your plantar fasciitis, of course, itis means inflammation, so you want to use some cold to possibly help take that inflammation down. So you could freeze a bottle of water, and you put it down on the floor, and you're just going to roll your foot over top of the frozen bottle. So you're going to get a little bit of the myofascial massage, but you're also going to get the cooling effect of the ice. Now, the muscles of the leg may also be a contributing factor. So I'm going to show you how to stretch your calf, and then of course try to lengthen the Achilles and also stretch your soleus muscle, which is a bigger muscle that's underneath the calf. So of course, many of you know that this stretch, hopefully you can see that okay. So this stretch where you have the back leg straight, front leg bent, leaning against a wall, my body is straight, and you're just bending forward towards the wall. But I'm not bending like this. My hips are coming with me forward like this. This is for the calf. But if you want to get into the soleus, you're now going to, I love this part, you're going to drop your back knee, rather, not the front knee. You're going to drop the back knee, so you bend it towards the floor, almost like you're going to do a little bit of a squat, and you're going to feel that stretch go all the way down the back of your leg and into the heel and even into the Achilles area. Super nice little stretch to do that. And some of you already do this, I'm sure, but your staircase is a huge help at home. You'd be holding on to the sides for security. I'm going to try this without holding on to anything. So you're going to put your toes to the edge of your step, and then you're just going to drop your heel. See how it's going? That would be parallel kind of thing. You're going to drop the heel as far as you can, and you'll feel the stretch coming up the back of the leg. And of course, as always, you're going to do the other side. Try to hold for the 15 to 20 seconds. Now, if you have a more severe case of the plantar fasciitis, you can come into the office, our office, or your physiotherapist office, or your massage therapist office, and you can inquire about laser therapy. That is a very effective therapy for releasing the problem with the plantar fasciitis. And some other offices do offer shockwave therapy, and there has been evidence that that can be helpful as well. The last thing I'm going to touch on though is orthotics. So sometimes no matter what you do, all of these other things that you're doing, you may still be experiencing a problem. And it may be resolved with a pair of personally formed custom orthotics. So to get a well-made pair of orthotics, you have to have your gait analyzed as well as all the joints of your foot, and then a mold is made of your foot in the proper position, and then a corrective pair of orthotics can be made as well. So that would help with the biomechanics of your gait, because you may have a flattened arch or an overly supinated arch, and those things are out of your control. You may have been just born that way, so sometimes you need a little help with an insert. So those are some of the tricks that you can use to help with, sometimes a debilitating disorder. Plantar fasciitis can have a number of underlying causes. It could be that you're not wearing the proper shoes. So please, when you are buying shoes, be mindful of getting something that has a good arch support in there. Also, for those of you that are in the house, in the kitchen a lot, or standing a lot, you should probably be wearing a pair of either good walking shoes, or get yourself a pair of indoor Birkenstocks, let's say. I know they're not cheap to buy, but they will last forever, especially if you're wearing them inside the house only. So those are some of the things that you can do for yourself to help those little tootsies feel a bit better. And the better your feet feel, the more likely you are to get out and do those other things that we're asking you to do for your own health. So that's it for today. And remember guys, motion is lotion.